Political unrest, economic collapse, a healthcare crisis spiraling.
The medical situation here in my country is like if you are in a country in war, but with no war. That's how deep is the crisis.
If you're on the streets of Venezuela, the desperation is palpable. 4 years into President Nicolás Maduro's term, Venezuelans live with skyrocketing inflation. The price of oil, the country's main source of revenue, continues to plummet. Shortages on food and medicines, with a healthcare system in total chaos.
We have almost half of this hospital closed because we don't have enough nurses to work, we don't have enough medicines to use with the patients, we don't have enough doctors here, we don't have antibiotics, for example.
Dr. Laura Sanchez works at the Medical Center of Caracas, one of Venezuela's best private hospitals, and is a member of the ICU team. She comes from a family of doctors.
Every day you can see that you have less medicines, less resources, you have more diseases because you have more social problems. You know what you have to do, but you can't do it, and it's very hard for us here.
Here, the patients and their families are responsible for getting the medicines needed. Often, families end up having to ask relatives abroad to buy them drugs and supplies, while some turn to the black market, where medicines can be more expensive and unsafe. According to Amnesty International, half of the country's hospitals across the country are closed.
Un país donde tú vas a un hospital y los enfermos están tirados en el piso, un país donde muchas veces las mujeres embarazadas tienen que dar a luz en la puerta del hospital porque no hay cama, un país donde a ti no hay un quirófano para operarte.
And against this backdrop, doctors battle the resurgence of diseases like malaria, tuberculosis, and diphtheria.
You can see those little children malnourished and with diseases that in any other situation we can resolve, but here we can't. And you see them dying, and it's very hard.
Maduro refuses to acknowledge that there is a humanitarian crisis in the country and won't allow international aid to enter Venezuela. Local NGOs, like Comparte por una Vida, are trying to fill the void left by the lack of foreign help. They provide food to children in hospitals and schools.
Toda la fundación comienza con una iniciativa a partir de que queríamos alimentar a 30 de 38 neonatos, bebecitos, que estaban en riesgo de morirse en el hospital JM de Los Ríos por falta de fórmula, por falta de comida. Posiblemente estos casos que nosotros agarramos no van a morir de desnutrición, pero van a morir de cualquier otra cosa, o de que entraron con una sola cosa al hospital y salieron con 10.
I started to work in 2012, and the medical situation here was bad in comparison. If I compared with the work that my father have, and every day we have seen people going to another countries.
It's estimated that as many as 4 million Venezuelans have fled the country in recent years. But for Sanchez, leaving is not an option.
I think a lot of people need us here, and I think I should be here because someday I would like all of those people that are outside can come back here. We need to work for this country and for them, for the people that still are here.
In the middle of the chaos and constant unrest, Venezuela is set to hold elections this year, and Maduro is expected to win. As for the health crisis, there's no end in sight.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.